You're listening to a Raconteur Studios podcast.
Hi, I'm Dr Emma Craythorne. I'm a consultant dermatologist and this is the After Hours Skin Clinic. Expert skin advice on those questions I'm always asked outside my clinic. In this episode, we're talking about moisturisers for the skin. This is part 2, and this is really more focusing on those patients who are prone to eczema. And once again, I'm totally delighted to be joined by my friend and fellow dermatologist, Dr Ellie Rashid.
Hello, thanks for having me back.
So when we think about eczema, this is a problem for so many people. You know, it's estimated probably around about 10% of the population have this going in some form or another. And for those other 90% of the population who don't have it, probably have a family member who's suffered from it. And I don't think anyone can underestimate the absolute burden that this can cause on not just the individual but also the family. The itch that goes alongside eczema can drive people to complete distraction in terms of their sleep disturbance, in terms of how they feel about themselves, in terms of their performance the next day at work or at school. And it really is something that can really overtake someone's thought processes. So for those of you who have eczema and are listening to this, I get it. And for those of you who don't have eczema, I want you probably to imagine a time whenever you had a really itchy insect bite and it was really annoying. Well, that happens to somebody and it can affect their entire body. So you've got some idea of how much this can drive people to distraction. So talk a little bit to me, Ellie, about how much of a problem this is and an epidemic that it really is increasing.
So eczema affects 1 in 10 adults, it affects 1 in 5 children. And although 2/3 of children will grow out of it by the age of 7, that still leaves a significant proportion that will be affected by eczema. I think where it is so common, sometimes it can be trivialised or normalised, like it's just some dry skin. But there is a population that have a real battle with eczema. And I'd probably describe it as a battle. They are on a journey with their skin.
Because whenever you think of some of the stats that get associated with this, you know, so if you are an adult and you're facing this essentially as a long-term condition, they did a study looking at, you know, how do you rate your health? So imagine you're an adult going to work, you should be in your prime and you've got eczema, this common skin condition that sometimes, like you say, becomes normalised. And of that, about 20% of people would have rated their health as fair or poor, or their quality of life as fair or poor. I mean, that's really a quite astounding statistic, isn't it?
Yeah, and itch is such an unpleasant symptom. So people prefer pain and extremes of temperature to itch. Have you ever scratched something so you do it until it hurts?
Yeah.
Because when it hurts, that's a more pleasant sensation than the itch. And there's so much about sleep and the quality of our sleep and how our performance improves if we've had good quality sleep. And if you're up scratching all night, you're affected. If you're a young person, your caretakers, your parents are affected, siblings, your partner. So it really does affect the entire household.
Yeah, I mean, on the point of sleep, in another study that was done, they looked at the amount of time a child would actually have a good amount of sleep if they were in this moderate to severe group of eczema that was uncontrolled. And when we think about our kids, you know, your little boy is 2 now. How many hours sleep does he get a night?
About 12 hours of sleep.
And you feel guilty, right, if he doesn't get that amount of sleep because that's what's required for growing. Whereas these children are getting in and around the region of 4 to 6 hours of quality sleep. So you can imagine then the impact that has on learning and growing and, well, even relationships within the family, because then the parents are typically up as well.
And if a child hasn't slept well, they're groggy the next day. And it's not fun to be around.
I'm groggy the next day if I haven't slept properly.
I'm groggy the next day.
I know you are, yeah, that's right. I've seen you after not enough sleep, Ellie Rashid. Okay, Ellie, so we're going to get into this now. First of all, what is eczema and what causes it?
So eczema is usually driven by a genetic predisposition. So there's a protein that keeps our top layer of cells nicely, tightly packed together, and that's called our skin barrier. and that protein is called filaggrin. So people with eczema have a problem with the creation of filaggrin, which means that there are lots of gaps between these cells that form this top layer of skin, which means water can escape, their skin can be dry and dehydrated, and then their immune system responds to that dryness. And it almost overreacts to that dryness. And this whole immune cascade is started, and it gives rise to this really itchy and inflamed skin.
And are there certain triggers that can make this worse?
Yeah, so there are a number of triggers that can make it worse. So there are some environmental triggers. In some cases, UV light, for example, although it can make it better, in some people it can make it worse. Certain fragrance chemicals can make people's eczema worse. Certain ingredients within skincare can make people's eczema worse.
I often think as well, so where we have this mutation in filaggrin, and its job is obviously to keep everything nicely, tightly packed together, I think, yes, that's where you lose the water out and then you get this response of dryness, just as you've said. But also these gaps allow things that are on the outside to then get in. And certain bacteria that might live quite happily on the outside of our skin, release their toxins quite happily and doing a good job, can suddenly become problematic in eczema. Also, things that we are exposed to, so other antigens we call them, so proteins that might irritate the skin, so things like house dust mite or pets or chemicals. We don't necessarily even get a true allergy to them, although in many cases you can. But then these can just irritate the skin even further. So with eczema, you get all of these irritants coming in and irritating. You've got that water being lost, which is irritating. And by the very nature of eczema, the whole thing is just irritating. And then for some people as well, this is exacerbated whenever they have other conditions like hay fever or asthma.
Yeah, I normally tell patients that have eczema, anything that ignites their immune system almost kickstarts their eczema as well. So you've had someone that's got good, well-controlled eczema, then they get flu or cold or something like that. Because their immune system is being triggered because they're trying to fight the cold that they've got or their hay fever's been activated, then that also seems to trigger their eczema to be more severe.
And so I think keeping these things under control can also help the triggers of the eczema. So let's talk about what the treatment is for eczema. Now, I know that your son knows the treatment for eczema.
Yeah.
In fact, it might have been his first word.
It's one of
Let me hear it. I love hearing it.
the first words.
Let me
that
hear
he's
it. It's
said.
so cute.
What's this called?
Moisturizer.
I think we should just call it that from now on. So the number one treatment for eczema is moisturizer.
Moisturizer.
And not all moisturisers are created equally. And there was a really important couple of studies carried out by one of the heroes of dermatology, Professor Cork. And he really details in his studies which kind of moisturisers are best used for eczema. So talk me through the moisturisers you think are important, Ellie.
Yeah, so when I think about moisturisers in eczema, you want to use something that has 3 main ingredients in different ratios. So you want something that's got humectants in it, so things that draw water towards it. You want something that's got an emollient ingredient, so things like ceramides. Then you want something to keep the skin waterproof, so like an occlusive layer. So these are things like petrolatum that can be in some of these thicker emollients.
What I found so interesting in that paper is that, where in the past we used to say to somebody, oh, just put on this thick emollient, put on this thick 50-50 cream, these really occlusive, thick Vaseline-like treatments. Actually, the study then shows that, yes, it's very good as an occlusive agent, but it's not as good as if you have something that's got the right combination of ceramides to really help and additionally make that skin barrier better. Those emollient agents of ceramides are the key to actually try and plump out the cement. So yes, you plump it out and then you have the occlusive agent on top. So I think that we now know with this lovely combination of ratio of ingredients that moving to using something like a nice moisturising cream that has these additional benefits is not only beneficial because patients like to use it, but we know that the effect of it lasts longer. So you can then get, in fact, some of the studies go up to 48 hours, whereas something like those old 50-50s that we used to do are really only ever got about a 6 or 8 hours protection. The other thing that often is discussed is whether antihistamines are effective. And what's interesting about antihistamines is we used to, again, use these routinely for many of our patients who have eczema. And actually, it's a very controversial topic in dermatology. But actually, the use of antihistamines, we know, decreases sebum output. So it's quite interesting that actually it probably makes very little difference in terms of whether it's helping eczema or not. But I think it sometimes can be helpful for those overnight young children. What's your take on that, Ellie?
So generally, I don't advise antihistamines for managing the itch of eczema because histamine isn't really the main driver for the itch. So you want to calm down the inflammation in another way. But if you're suffering with insomnia or your child is suffering with insomnia because of their eczema being so severe, in some cases, people do use a drowsy antihistamine, so something like Piriton or hydroxyzine for that sort of helping them get off to sleep benefit. And as we talked about earlier, sleep is just so beneficial. But I don't recommend it for managing the itch associated with eczema.
Yeah.
The circumstance where an antihistamine might be helpful is in those patients where I said their hay fever can really trigger their eczema, so it sort of all comes up at the same time.
Yes.
Then you want to use an antihistamine to keep your hay fever under really good control and then manage your eczema separately.
That's a good point. What about things like washing detergent?
Yeah, so many patients that come to clinic will say, I've been using this particular laundry detergent, and is that the thing that's driving my eczema? And the answer is usually no. I don't think there's a relationship between the laundry detergent that you use and the development of eczema, or even really the extent of eczema. So I generally don't think people need to worry so much about it.
Yeah, unless, of course, there's an allergen within that laundry detergent, which is a separate issue altogether.
Exactly.
And by allergen, we mean something that you're truly allergic to. So, something like nickel, for example, is the commonest thing that people might be allergic to. You're not going to find that in a washing powder, washing detergent, but you might find some of the other preservatives or the fragrances that people are allergic to. So that can make the eczema worse, but it's not really the thing that's typically causing it in somebody. So let's have a think then about what treatment does work. Should we divide this into somebody who has a mild eczema and how should we treat those? Now, we know we've got the moisturiser, which covers both parts.
Yeah, so patients will come to clinic and they say, I've been using this moisturiser, but it's not managing my eczema. So if I divide eczema treatment, it's usually to maintain the skin barrier, and we do that with moisturisers and soap substitutes. And then it's to manage the inflammatory component of the eczema. And that's usually calmed down with topical steroids, and they come in different potencies or strength. So you'd use a different potency or a different strength depending on which part of your body you might be treating or the severity of the eczema that you have in that area. And there are other creams which don't contain a steroid but still have an anti-inflammatory benefit called calcineurin inhibitors, and they can be good to maintain the response that you've had after you've used a steroid-based cream. If you use these other anti-inflammatory creams directly onto very inflamed eczema, it can sting sometimes. So we normally say let's calm down the inflammation with a topical steroid and then maintain it with these alternative anti-inflammatory creams.
I think that's right. I think the key is for this mild eczema is that you're on the right moisturiser. So you have to have one that you like to use, that is comfortable to use and is an effective one to use. So moisturiser is key, and understanding how to put that moisturiser on properly every single day in a way that doesn't feel boring, it doesn't feel like it's annoying to have to do, it is also key, because otherwise you just won't do it. And finding one that's going to be long lasting, so it will last throughout the entire day. So I think that's key for the moisturiser. And then when it comes to the application of topical steroids, I'll often say to my patients, the gold standard treatment for eczema is the use of topical steroids. This is the thing that will get it under control. And often people will come, they're potentially a bit frightened about using a topical steroid, or they've not really been shown how to use the topical steroid properly. It comes in different forms like creams and ointments, and that can get a bit confusing. So it's understanding how to use that treatment properly. We talk about fingertip units where we squeeze a bit of the steroid out onto the tip of a finger, and that would essentially cover a hand's worth on the body. So that is the right amount of steroid to get the dose that you need, and that's how it should be used. Now, it should be done under the kind of guidance of your doctor or dermatologist, because if you're using that steroid every single day for 6 weeks and you're not getting anywhere, then often the steroid dose might need to be escalated. And even if it's at these higher doses and you're not getting control of it, it's usually around 6 weeks where you're starting to think, actually, we need to think about a different plan.
I normally say to my patients, because I never know how long to use a topical steroid for, and one of the things that can happen is a parent will use, or a person will use, a topical steroid on their child or on themselves for a few days, and then they stop and the eczema seems fine, and then a few days later it all comes back again, and then they use the steroid again for 2, 3, 4 days, and then it calms down, and they get into this cycle. So I normally say to use the topical steroid until your eczema is gone, and then maybe use it for 2 days after that, or to use it for 1 or 2 weeks, and when things have calmed down, wean down the dosing with the topical steroid. Then the other thing to mention about topical steroids is, we used to say to use topical steroids twice a day in the past, but there was a big study looking at topical steroid use twice daily versus once daily, and the benefit was exactly the same. And actually in the twice daily, there's slightly more risk of some side effects associated with topical steroids. So the recommendation is usually once a day. Most people choose to do it at night, just so you're not sort of running around and doing things. And then to use it for 1 or 2 weeks until the eczema is gone and calmed down, and then either to use it for a few days beyond that, or to just wean it down to alternate days. And there's also a role for weekend therapy with topical steroids. So if you're someone whose eczema just keeps relapsing, then you can do topical steroids on a Saturday and Sunday and just keep doing it, because actually there's huge benefit of having 5 steroid-free days.
Yeah, I love that. I'm a massive fan of steroid at the weekend. Should you need to keep somebody on something and they're not keen to progress to the next level, and it often will just keep things under control so people have a much better quality of life. So let's move on to them. What if topical steroids are not enough? What if the disease is just continuing? You know, the steroids are either you're just putting too much on, you're needing to put it on for too long a period of time. What happens then?
So there are a few options at that stage. The one option is something like phototherapy. So that's UV light therapy. People say, well, can't I just go out and sunbathe? But there are a few things with sunbathing. One, you don't know what dose of UV light you're getting. You're potentially increasing your risk of burning and potentially increasing your risk of skin cancer. With UV phototherapy, or the dose of UV light that you're getting is very well monitored, and it can work as an anti-inflammatory. In terms of systemic treatments, there are some tablet treatments that can modulate or slightly suppress this overreactive immune system that's sort of overreacting to this dry, cracked skin. And then should these oral, so things that you take by mouth, tablet medications that modulate or suppress the immune system to try and calm the eczema down, not be sufficient, there are these injection drugs that we can give that are called biologics that can very effectively target the pathways that are dysregulated and responsible for the itch and inflammation in eczema. And another group of drugs that's more recently come out are called JAK inhibitors, JAK inhibitors, and they can be really helpful in eczema.
I mean, I think it's wonderful. You know, when I started off in dermatology 20 years ago, then we'd have wards full of patients who were in for treatment for their eczema. And now we don't have anyone in hospital for this.
Completely. When I was a registrar as well, so this is like 14 years ago, when I first started dermatology, exactly the same. Wards full of eczema patients. And if you imagine your skin is very inflamed, cracked, it's not working very well as a barrier to things like viruses and bacteria. You can get bacterial complications, you can get viral complications where a virus will affect all of your skin, and those patients could be really sick. So they would end up in hospital, usually being treated with intravenous antibiotics or intravenous antiviral treatments.
Yeah, so I think the message is that some people do progress from mild eczema to this more severe form, but now there are wonderful treatments available to help restore people's quality of life. You know, I remember one of the patients that was on the television series that I do, the Bad Skin Clinic, with such severe eczema. He's a lovely man from Cardiff, and his entire life, as you can imagine, was destroyed. He was red from head to toe. He was scaling from head to toe. He was constantly scratching, repeatedly getting infections because he was scratching so much. He couldn't go to work. He couldn't take his children to school. He was just, you know, in his house. And the key thing that, changes him is, number one, this explanation of how to use a moisturiser properly, getting things under a bit of control by understanding how to use a steroid properly. But that was only really to hold him until he was able to be treated with some of these more impressive biologic treatments. And these things are life-changing.
Completely life-changing. I do a severe eczema clinic every week, and the difference it can make to patients' lives is incredible, and to the whole family's life as well. Affects everyone.
So I think the key is that if you are listening and you're somebody whose eczema is out of control and you're not able to get control of it, the days of just having to put up with this are really gone. There are lots of really effective treatments that are available, and it's something to speak to your doctor about referral. Shall we talk a little bit about some tips for people who have children, for example, and they have eczema?
So applying moisturisers and topical treatments onto a very little baby is easy. They don't move too much. But then as they get older, particularly in the toddler years, I found it really difficult to treat my own child with moisturiser. But there are different formulations, so you can get a spray moisturiser, for example. That's sometimes easy to do quickly. I usually have a moisturiser in the bathroom, so as soon as they've had a shower or bath, put it on all over. I normally have one in most bedrooms, so whichever room we happen to go into after a shower, I've got it there ready to go. I normally get my little boy involved in his eczema treatment, so I'll put some moisturiser into his hands and then he will apply that onto the part of his body that he chooses to put it on, whilst I'm doing the rest of him. So that there are ways to try and get them involved in the process. And now he will say, as soon as he's had a bath, he'll say, moisturiser. And he knows it's time for him to have his moisturiser treatment.
I think that's right. It's, even from a very young age, giving ownership to that part of the routine and trying to make it fun, because it is otherwise so boring.
So boring.
And children really do not like feeling sticky and gloopy and, they're already cold once they've got out of the bath or the shower. They just hate it. So it's about trying to work around it where you can, when they're wet, putting the moisturiser on, then you can pat them dry so they don't have that horrible sensation, making it fun, like you've described doing with Lucas. And Motty, who's our wonderful nurse as part of the Bad Skin Clinic, she makes these beautiful bath bombs for children with eczema. So she creates them out of the old-fashioned ointments that we used to use. So you can just get a nice fancy ice tray and put this ointment inside the ice tray, and you can put fun things in it like rose petals or biodegradable glitter or fun things like that. And then they create these bath bombs that are actually quite eczema friendly. So it's all of the things of trying to make it a little bit fun.
I'll do it without the glitter. I don't want glitter all over my bathtub. Great idea, though.
Love glitter. Love it, especially when my husband then goes in and has a bath after, and then he goes
Gets
to work
everywhere
covered in glitter. I sometimes do it just for that reason. So before we go on to our recommendations, are there any tips that you have typically for people who might be very itchy? Are there things that you would do to try and break what we call this itch-scratch cycle? And by that, I mean, when somebody is itchy, they scratch. And unfortunately, when you scratch, you make it more itchy and therefore you scratch. So you've got this cycle of itch, scratch. And at some point, it does have to be broken. What kind of tips do you recommend for that?
So I've got a few tips. One would be to keep your moisturising cream in the fridge. Sometimes applying a cooled moisturiser can help with the itch sensation. I normally recommend to just tap the skin or pat the skin to try and confuse your skin out of that itchy sensation. Some people, I normally ask them to have like a fidget toy or something that they can distract themselves with, so they're not so inclined to itch their skin.
Yeah, and I think being thoughtful about the clothes that you might wear. So certain clothes will make your skin feel more scratchy. And it's trying to avoid those kind of rougher clothes or rougher fabrics that also might irritate the skin. And even things like where you might sit on something. So things like sitting on grass is a really itch-provoking activity. So it's just thinking about what's in your environment and what clothes that you're wearing. And then these other kind of like tips. I love the tapping. That's what I recommend as well, to try and get away from the scratching element of it. And actually, one of the other things that I like is actually the wearing of false nails. So these acrylic nails, it actually stops some people from picking especially. Some people go on to develop a condition called neurodermatitis where itching and scratching makes these little bumps that are itchy or scratchy, and then you pick at them and create bigger bumps. And actually often the wearing of acrylic nails can help that. Obviously it doesn't help if you're allergic to the acrylic nails, but you know.
Yeah, and wearing acrylic nails also helps you not bite your nails. Relevant for me only.
Are you a nail biter?
I'm a real nail biter.
I did not know
Isn't
that.
that so bad?
Yeah, one thing I didn't know about you. So tell me, what is your go-to recommendation as a soap substitute? Because we typically don't recommend washing with a soap, which can be drying of the skin. We really want to use skin cleansers that have got additional moisturisers within them and have a low pH.
So my top soap substitutes would be something like the Avène Lipid Replenishing Oil, but I normally just warn people that it makes the bath quite slippery. And the other thing I recommend is QV Emollient Wash.
I like both of those. My favourite go-to, and the one I've actually been using routinely on all of the patients with eczema through the Bad Skin Clinic series, has been the La Roche-Posay Lipicar Syndet, their wash version of it, which complements really nicely the moisturiser that I recommend, which is their AP plus M Balm. And that's what I've used the entire way through the television series. And sometimes I've had these patients come on with their really quite bad eczema, and I've teed them up thinking they're going to need to go and do a biologic, and with the right moisturising advice and topical treatment they've been able to avoid that. What's your moisturiser that you like?
I'm going to say the Lipicar Balm. I think it's lovely. And then my other moisturiser that I normally recommend, I like the Bioderma Atoderm range.
And the other one is the Vanny Cream. I quite like that for the face. And you looked at me quite funny, like I said fanny cream, which actually most of my patients look at me whenever I say, you can go and buy some Vanny Cream. And they say, what? It's my face is the problem with my eczema. And I say, yes, but this is Vanny Cream, not fanny cream. So that's really good, I think, for facial eczema. Super moisturising, nice blend of ceramides, and doesn't have really much in the way of preservatives or all of the other nasties that we don't like for eczema. But it is Vanny Cream, not fanny cream.
Thanks.
Well, that's it for this episode. Thanks so much to Ellie for joining me.
My pleasure.
And thanks to all of you lovely people for joining us. If you didn't listen to part 1 of our Take on Moisturisers, that's also available to be listened to. If you haven't already, take a moment now to click on the subscribe button so that the next episode will pop up like magic in your feed. See you next time on the After Hours Skin Clinic.